Okay, this is my redo of the introduction because we had so many problems with the Zoom. All right. Um, so welcome to AP2. I'm Sherry Bowen. I'm your instructor. You'll see a lot of me in the videos because all the videos, that's me just recording that. Okay. So this is your home. This is when you open this up, it's going to have the most recent announcements. Make sure you take a look at these because any changes, any announcements, I'm going to be putting them up here. It's my way to communicate with you guys. I will also give you notice of when something is due, usually 2 days before it's due. I'm like, hey, this is coming up in 2 days. And then the day it's due, I'm like, this has got to be done by midnight. So make sure you check these because sometimes things happen. We get storms, we get whatever, and things have to be canceled and things have to be changed. So that's where I would announce this. So make sure you check your announcements. Okay, and you can go back and look at all of them. Here's your syllabus, which I fixed. Jeez. It's one of these days, right? All right, so the most important thing is there's my name, there's my email address if you need to get a hold of me, and I will answer email within 24 hours. Weekdays, weekends, holidays. When I have a course going, I'm on every day, usually in the morning. Okay, so that's when you'll usually see me. Here's your course learning outcomes. So this is AP2. That means you successfully completed AP1. Way to go. Good job. Now, this is a little different. AP2 is a little different. AP1 was 8% memorization. What is the name of the bone? What is the name of the muscle? What does the muscle do? And so on. And you had muscle fizz and nervous fizz. And that's it. This course is just the opposite. It's 80% physiology and 20% anatomy. So it's how things work. So, you're going to need to learn how these things work and why they work. So this is basically our learning outcomes, but we're going to finish the rest of the book. All right, the textbook officially is wholes. But if you have some other book that you used for AP1, if this is not within, for the high schools, if you can't get it easily, any AP book will be fine as long as it's been published in like the last 10 years. So if you can go and get a real cheap book, off of somewhere, go for it. Just make sure that you're going by the chapters. But, if you can get a cheap, textbook, go for it because basically the anatomy and physiology checks are basically the same, and I'm going to provide you with the information that I want you to get. Okay, so you guys want to know how you're going to get your grade. So you have 6 units, a lecture exam, and a lab practical over each unit. So you'll end up getting 6 lecture exams and 6 lab practicals. Okay, so each of these will only cover 2 units. So if you look at this, 6 lab exams, 6 lecture exams, 30% of the grade. So each exam is 5%. Okay, 5%. You will have frame notes. I'll show you that in a few minutes. But for each chapter, you have a presentation that I have done, and you have guided notes. And you fill these in. You may not be able to get them all off what I'm saying, but go and Google stuff. It's okay. Fill those notes out and turn them in by the deadline. If you've completed everything and everything looks good, you'll get 100%. If you don't fill it out totally, you're not going to get the 100%. So, what can I say? You'll have lab exercises to do, drag and drops, matching, that sort of stuff. And then you're going to get case studies and discussions. You'll have one discussion per unit, and 3 places within the course you will have case studies. And I've done 3 different kinds of case studies so that, you're going to go further in your healthcare profession, you're going to get case studies. So I'm kind of giving you 3 different kinds, and just to help you through that. Okay, and then that's basically most of that in there. So I'm just going to go out of here. All right, so that's your syllabus. If you need more information, let me know, but read through that. And then you get to your modules. This is the most important thing. And I'm using, I know the instructor's view, so there's a lot more stuff on here. Probably should go to let me view as a student to make it easier for you guys. Here's that recording that would be done, and this will be placed right underneath. So, and I will take that recording off and go from there. So if you read this, it's about this course and how this course works. And so there's a lot of information on this, and it's basically, what I said, that you have a lecture and a lab, to-do list, you'll have assignments, exercises. This is the note-taking assignment, which I'm going to show you in a few minutes. And you have an exam study guide for every exam. Okay, I provide you with a study guide. If you go through this study guide and fill it out and submit it, and I'll show you where to submit it, and you answer all the questions and do a good job on it, you'll get 5 extra credit points on your lecture test. This is the only extra credit I give. And I don't give partial credit, because what I'm trying to do with this study guide is to tell you what's important, make sure you know it. Some people don't know how to take all this information and cone it down. Well, what I'm trying to do with this study guide is to show you how to do this. And if you fill this out and you make sure you understand everything on that study guide, you should do fairly well on the test. Okay? For the lab portion, you're going to have these lab activities. You can go back and do multiple tries. Some of them will be you're graded on the first try, but you can go back and do it again. But these will help you learn the material for the lab practicals. I've given you a specific list of materials. You will see the material for lab practical, whatever. If something's not on the list, it won't be on the lab practical. It may be in the lecture, but it's not on the lab practical. Okay? I'm pretty honest with that in terms of, if I give you a list of things and this is what you need to know, don't go studying something else, because it ain't going to be on the practical. Okay. For your discussions, I'm going to have discussion questions. This is AP2. These are going to be thought-provoking. There's no wrong or right answer. There's some, at least there's some right answer to it, but I'm not going crazy on making sure you've got the exact right answer, because these are a little more thought-provoking. So, in terms of the discussions, take a look at the rubric. But bottom line is, you answer the question, you have to have a reference. If you don't have a reference, it's 15 points off automatically. Okay? This is not English class. You give me a URL, that's fine. I'm fine with that. Just tell me where you got your information. So I'm making sure that you're using good references. Okay? Then you're going to make comments to 2 of your fellow students. Your comments have to be relevant. And what I mean by relevant, you can take a look at it, you have to add to the discussion. All right? Great job. You have great references. I really liked what you said. That's not an appropriate comment. The first time, for the first discussion, you might get away with it. You won't get away with it after the first one. You have to add to the discussion. So what you want to do is something like, I read what you said, I found the same material, and I also found blah, 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 blah. I see where you're coming from, but I approached this a different way, and this is what I found. So be polite, be professional, don't badmouth the person. If you disagree with them, just tell them, I found something different. Okay? That's okay, and to explain that. So I want you guys to interact, because these, again, are going to be thought-provoking questions. So we should have some pretty good discussions. And then I've already talked about the case studies. So I'll show you a couple of these. All right. So get out of there. And about your instructor. Yeah, this is me. And again, you're going to see my face. So my background is in healthcare. I was a laboratory tech, lab supervisor, lab director for 25 years. I worked in hospitals, blood banks, a stem cell transplant center, doctor's offices, all different areas. 26 years ago, I started teaching. So I've been teaching anatomy and physiology and microbiology since 2000. So I've got a lot of experience in this area. I teach primarily APII 1 and 2 and micro for the college. So if you haven't taken micro, I have an online micro class. What can I say? So you can see my grad degree is in clinical laboratory science. And I was licensed in these areas. So my degrees are really in healthcare. All right. So if you want to get a hold of me, again, there's my email address, and you can make an appointment. We can meet via the big blue button. Okay. So not a problem. All right. One thing you need to do is your syllabus confirmation quiz. This is a state requirement. If you don't get it done, you get dropped. So you have to get it done. I've got a deadline of the 26th. Got a couple more days after that, but I want everybody done by the 26th because I got to follow up, and I want everybody having completed this by the 26th. Okay? So make sure you do that, and we'll get you, through that. If you don't, you get dropped. So FYI. Here's Ask the Professor. So you got any questions? You're working on that exam study guide. Like, I just don't know. I don't know what she wants. Ask me. That's what I'm here for. I'm more than happy to answer these questions. Okay? So just ask, and I will help you out. Okay. So let's go and now look at the course. If you got any need help with Canvas, here it is. Well, let's look at the chapters. The chapters are all designed the same way. So once you get past, the first unit, everything's going to be exactly the same for all the rest of the units. So the first thing you'll see is an overview, and you'll get a to-do list. What is it I need to do? And sometimes these get a little long, but it's, you've got time. All right, chapter 13. Endocrine system. I'm going to be very honest with you. I've given you extra time because between APII 1 and APII 2, this is the toughest chapter. Why? Because it's the endocrine system. Why? Because the endocrine system runs most of the stuff. It tells what organ to do what when. All right. So this really is the brain of the whole body. And organizing things and getting things done and when we do it and how we do it. So this becomes a real important chapter. All right. So, and especially again, this is physiology. What we're going to get with chapter 13 is an overview. And then as we go through the course, we're going to get into the nitty-gritties of these different hormones. But I want you to know these hormones to start off with at least, and I've got a chart for you. The name of the hormone, where it's produced, where does it go, and what does it do, basically. Okay? And then when we get into the different units, we'll get into more specifics of exactly how it does. What actually does it do? And what are the outcomes? Okay? So you're going to look at the lecture presentation. Again, these are embedded. This is me talking. So I'm, getting you through this stuff. You're going to, if you get your textbook and you want to read, that's fine. You want to, you don't have to read the entire textbook. Take your notes, take your presentation. If there's something, you want to read down in on, that's what you use your textbooks for, okay? But as you're viewing that presentation, work on the structured notes assignment. Make sure that I've basically got this stuff organized for you, but take your own notes and do your own thing. At the same time, open up this study guide and look and see what I think is important for the test. So between the structured notes and the study guide, I'm coning you into certain information that I want you to know. Okay, so I'm trying to help you. And then I'll show you the submission where you submit it. There's your submission. You have 5 lab exercises to complete, and I'll show you those in a second. And then discussion topic and submission deadlines in chapter 14. So you want to go and look at that discussion topic, which I'll show you, but I'm telling you where it is. Okay? So that's your to-do list. So when you look at this, you go back here, I've organized it exactly the same. For your lecture is on top. That's your presentation. This is your link. You link on that and it will be me starting to talk. These are your structured notes, okay? You download them. This is where you submit that assignment, and you can see it's August 30th. I'm giving you, we are closing chapter 13 on the 30th. So you have, quite a few days to get through chapter 13. I've given you a couple, week and a half to get through this because I know it's tough material. So I've given you the extra time. Don't wait until the last minute to do it, because people ask me, how do you study? You study a little bit every day. Take, a half hour, if you're busy during the week, take a half hour. And then you can study more on the weekends, but study something every day. And when you study it, you start with that new material. And when you come back the next day, you go over and review that first stuff, and then you start on the second piece. Because what that does is it helps you remember what you just learned the day before. And if you keep doing that all the way through, the stuff that's in the middle is, oh, I know this stuff. I'm good. I'm done. It's putting it into more long-term memory. So the more you read and the more you work with it, the better off it's going to be. Okay, don't wait until the end. This material is too hard for you to sit there and cram it in one night. You will forget it. You will. All right, so here's your exercises. And you can see these are drag and drops, matching, and then a question set. So these are the 4 lab exams, lab exercises I want you to do this first week. Here are the instructions for the discussion board. Telling you more about what's going on with that discussion board. And then again, here is your study guide. I'll open this up and let you take a look at this. But you can see, this is what you're going to turn in. And you can see they're very specific questions. What are the differences between the nervous system and endocrine system? What is meant by antagonistic and synergistic in terms of hormones? List 2 hormones specifically mentioned that are antagonistic. On and on. There's your blood chapter that you're going to get the next chapter. And then it says, fill out the hormone chart. Yep, here you go. Okay, so here's the name of the hormone. Where is it produced? Where does it go? What is its basic action? And yeah, we got a couple pages of this, but this is what you need to get started on. These are important hormones that we need to know. And again, we'll go through them as we get there. So, the human chorionic gonadotropin we'll get with the reproductive system. Okay? Testosterone, reproductive system. Insulin, yeah. Pancreas, but that's sugar. We'll talk about that. Epinephrine. So these are all the, we'll be going through these. Growth hormones and stuff like that. Thyroid hormones. But we're going to get a basic piece of what these look like and the different kinds of hormones and what they do and where they go. And that's your study guide. All right. And then here's the material for the practical. Open this up. Been very specific. There's nothing on hormones in this lab practical. It's all chapter 14. So 11 questions, 5 questions on blood smears, 3 questions on blood typing. Blood smears, be able to recognize all 5 types of leukocytes and functions, normal values, disease states are increased or decreased. Know how to determine a blood type. All right. You're going to have exercises doing this. When we get to that chapter, I'll show you. Okay. So this is the lab stuff for chapter 13 is all to help you with the hormones. Okay. All right. So then we get down to chapter 14. It's the same thing. All right. You've got a to-do list, an overview. There's your lecture. There's your structured notes. There's your note-taking assignment, exactly as you had with chapter 13. For the lab, I've given you 2 PowerPoint lectures that I want you to go through because this is a PowerPoint on these cells. So I want you to go through these cells. And then this is a blood cell genetics lab. Now for the lab exercises, I have Punnett squares. I don't know if you know what a Punnett square is, but in case you don't, there's a student guide. Basically, this is to figure out the genetics because we're like, okay, mama is type A and daddy's type B. What can my blood types be on the kids? And this is how you figure it out. So I've got some exercises on how to do that. And then I've got some blood cell genotype question sets. So this is all on this blood cell genetics. Okay. Here's your first case study. This is on anemia. All right. So I've given you a document. I want you to go through it. This is a lot of times you'll get a case study where you have to read the case study and answer questions. So this is the first kind of case study that you'll see. So I'm giving you information on anemias. Some of the tests, lab tests we look at for anemias. All right. What are when you get a CBC, a complete blood count, and you've got these, white blood cell count, red blood cell count, but then you get this MCV, MCH, MCHC. What does that mean? So I'm telling you what that means. Okay. And I'm giving you pictures so that you can understand. All right. And then I've got a case study, how we determine, how do we determine what kind of anemia it is? Okay, so there's iron deficiency anemia and the symptoms and the treatments. And then some of the blood tests that we would look at, the iron binding capacity, that sort of thing. If you got any questions on this, just let me know. Iron saturation, ferritin level, that's the protein that carries the iron. And transferrin, reticulocyte count. This is new red blood cells that are being formed. B12, folate, those kind of things. So I'm giving you that information. This is just some study, we'll get more up there. So that's the material. And I'm going to load the questions. And I want you to answer these. These have not quite been loaded up yet. All right, So you got this. All right. Okay. So that's going to be your case study. Let me go back out of here. I got a couple things to add to it, and then we'll get there. Let me see. That's 15. Okay. So that's your case study. This is your discussion. All right. This is a real patient that I had when I was working in the blood bank in the hospital. All right. Patient arrives in the ER. They had a ruptured spleen from a car accident. Physician orders 10 units of RBCs. Patient is A negative. What blood types can be infused in this patient? Okay. So the patient got 7 units. These spleens bleed. And they're heading to the OR. And the surgeon wants 10 units on standby. You're out of Rh negative blood. What are your options? I want you to understand that this can happen in mass casualty type events. If you're Rh negative, what can you do? Okay. So what possibly can you do? Are there any options? And again, there's no wrong or right answer on this. After this is done, I'm going to load up what I did. I will put it underneath with some explanations of things. So hopefully when you get done with the discussion, I will post it, read it and learn more material about this. So I'm going to try and help you through this in terms of that. Okay. All right. So we're back here. So that's your case study. And again, there's your exam study guide that I just showed you. This is where you would submit it for your extra points. You can see that 5 points. If you submit it, you can see we're not taking this test till the 11th. Okay, so I'm giving you plenty of time for these first 2 chapters because they're a little tough. Got to get you back in the groove, right? This is your exam. The first exam and the first practical I am not proctoring because I want you to see the exam. I want you to see what they're like, especially the practical, and then all the rest of them will be proctored. Okay, and we'll work about the proctoring software when we get to it. But that's where you're going to go to take the exam. Excuse me. Here's your material for the practical again. Same thing that we opened up, and here's your practical exam. All right, so this will open on the 11th, the day after this closes, and it will close on the 13th. And basically, if you've got a problem with the dates, I mean, I know it's Friday, Saturday, Sunday, okay? Maybe work the weekend. A lot of people, in healthcare are taking healthcare courses working. If you work the entire weekend, I've had students, I work a double shift, these two, can I take it a day later? You got to let me know. Talk to me. If you've got a real problem, let me know about it. I can give you an extra day. I can let you take the test early. I've had students say, I'm going somewhere. I'm going on a trip. My family's doing this trip. Can I take the test before I leave? Yeah. Okay. But you got to communicate with me. All right. So as long as you communicate with me, we'll get there. Okay. So you can see going on down, here's the second unit. It's exactly the same. The only difference is we're starting into dissection a little bit. So there's some dissection for you. Lab exercise. There's your study guides. Looks familiar. There's your lecture. There's your lab exercises. There's your discussion board instructions. There's your discussion. This is a little different, okay? What is a likely reason to explain why vertebrate animals evolved an adaptive immune system rather than an innate immune system, okay? Ooh, interesting, okay? Okay, so a little bit different, all right? And same thing, there's your study guide, there's your exam, there's the stuff for the practical. Go down to 17. Same thing, just exactly the same thing. This one is a little bit different. Your discussion is on a nutrition exercise. I want you to take a food that you normally eat and analyze it. And I've got what I want you to analyze. And then I want you to say, will you continue eating this? If you will, why? What do you like about the food? What do you not like about the food? I'm going to make you take a look at what it is you eat. Get a food label from a food and go for it. So this is exactly the same all the way through, all the way to the end. And you get your analysis, and you can see these little lab exercises. There's a worksheet I've got you to do. So this should get you through this material and get you through this class. So this is the introduction to the course. If you need any help, just email me or post in Ask the Professor, and hopefully this will get you through this course, and look forward to working with you. Okay? All right.